Hello everyone, my name is Jomon Joy. I would like to welcome you in our group presentation on health promotion addressing cardiovascular disease in the Aboriginal and Torres Strait Islander population of Kalamburu, which is a remote area in Wyndham, Western Australia. Before proceeding with group presentation, I would like to introduce my group members, Jinsi Thomas, Navjot Kaur, Sanal Kumar and myself. We all are second year nursing students studying Unit 401 206 Aboriginal and Torres Strait Islander Health in Western Sydney University. In this presentation, following topics will be covered. Sanil Kumar focusing on relationship between culture and health. Jinsi Thomas will be presenting social determinants of health. Navjot Kaur will be covering culturally safe nursing practice for Aboriginals, and myself health promotion. I would like to provide a brief overview what we will be covered in this discussion further. This presentation focuses on Aboriginal communities living in remote areas and analyzing the link between their culture and the health. Furthermore, it provides insight about the role of health promotion in improving their overall living standard. Discusses further how chronic disease such as cardiovascular disease can be addressed and managed through involvement of health professionals. I would like to discuss aims and objectives of this presentation. The aim of this presentation is to understand Aboriginal rich culture and traditional customs and assisting nurses to become culturally competent in their practice and therefore improving overall health of the Aboriginal community. The social determinants affecting cardiovascular health are education, physical environment and lack of health services. Addressing these issues through health promotion and improving their socio-economic conditions would help to reduce to large extent mortality rate. Nurses need to develop critical awareness of Aboriginal culture as a relational process influenced by physical environment in order to address health issues through adoption and integration of their tradition or cultural perspectives in their practices.
In this slide, we are discussing about the link between indigenous culture and their health. The central focus of the identity of Aboriginal and Torres Strait Islander people is the attachment to their country. This kind of attachment reflects their connection to the extended families, their traditional values and beliefs, and also the bond with their spiritual ancestors. Mob or country is referred to as traditional classifiers for them. Removal from country can cause adverse effects on their physical, mental, and psychological health. According to Hampton and Toombs, kinship structure forms the basis of the culture, values, beliefs, spirituality, and identity of the Aboriginal people. Due to limited basic advanced health care services such as affordability and availability of medical centers in remote areas, Aboriginal people are prone to many chronic diseases, including cardiovascular disease. It accounts for almost a third of the gap in the life expectancy between the indigenous and non-indigenous people and has resulted in a higher morbidity and mortality of the Aboriginal people. Indigenous people believe in traditional remedies, especially bush medicines. Gankari healers are the traditional bush medicine healers. They are very sensitive to their culture and language. They use native medicinal plants to treat many illnesses such as diabetes and cardiovascular disease. They are resistant to use the general medicine in healthcare facilities due to lack of awareness and sensitivity to their culture. The decision of Aboriginal Torres Strait Islanders people about health services, acceptance of treatment, prevention and strategies of health promotion all can be influenced by their culture. Culturally competent services can result in more effective and better health outcomes for them. In this slide, we are discussing about healthcare needs. Health promotion not only involves government agencies, but also local communities who understand their health issues, needs and requirements. Multidisciplinary and ambulatory care of people living in the remote areas and having a high risk of cardiovascular disease requires collaboration within the healthcare system as well as the Aboriginal health workers. Health promotion such as providing access to health facility, health education or awareness, promoting physical activities like sports, providing employment opportunities and ensuring the availability of nutritional food and recreational facilities will improve overall community health and prevent disease such as cardiovascular disease. With the current government health promotion initiatives integrated with the indigenous traditional medicines, latest medical facilities and the involvement of local indigenous health workers has given a sense of participation, responsibility and engagement to local communities, resulting in overall improvement of Aboriginal community health. In the next two slides, we are presenting some of the statistics regarding the access healthcare in remote areas compared to urban and regional areas and prevalence of cardiovascular disease in the remote areas. Before I start, I would like to focus on statistics available in Kalamburu community. As per Australian Bureau of Statistics 2014, Indigenous Australians living in remote areas are more likely to suffer from cardiovascular disease compared to those living in non-remote areas. Further, when compared to non-Indigenous Australia, Indigenous population die twofold from heart disease. The focus of this assignment is Kalamburu community. It is remote community in Wyndham, which is a part of East Kimberley, Western Australia. According to 2011 census, the population of this community is 467 people. For many thousands of years, two different Aboriginal language groups that are Winni and Kulari were living there. The prevalence of cardiovascular disease in remote area has affected the mortality, morbidity, life expectancy and quality of life of the individuals as well as the community. Some of the major factors contributing for higher rate of cardiovascular health issues are high prevalence of smoking, drinking, unhealthy food habits, obesity and lack of physical activity. Indigenous people have more stressful life due to reasons such as lack of employment, low socioeconomic status, which has overall affected individual as well as their family. Another contributing factor is lack of physical activities resulting from changes of traditional food habits like hunting, etc. This has led to obesity and therefore contributing to unhealthy lifestyle. Lack of availability of nutritional food in remote areas has changed their food preference, leading unhealthy lifestyle. So in this graph, we are showing some of the prevalence, lack of healthcare service comparisons in the compared to major cities, inner region, outer region, remote and very remote areas. According to AHW graph, GP availability in remote areas substantially reduced in the remote areas. The nearest hospital with the minimal facilities is located 568 km from the Kalamburu community. and it takes 12 hours to reach there. In these slides, as per the Australian Bureau of Statistics 2013 study, it is found that in remote areas higher rate of cardiovascular disease exists. Over 51% of indigenous Australians are daily smokers in very remote parts. Higher rate of cardiovascular disease in remote and very remote population of indigenous Australians could be attributed to their smoking habits and their psychological stressful lives they lead. Some of the main social determinants of health affecting cardiovascular disease among Aboriginal and Torres Strait Islander peoples are education, physical environments, and health services. Education is a process of gaining knowledge and learning skills, which helps individuals to realize their academic, intellectual, economical, and social potentials. Limited access to education is one of the social determinants of health for the indigenous community. It has resulted in increased unemployment, which contributes to psychological stress, poverty, low esteem, and substandard living lead to increased chance of occurrence of chronic disease. As per studies, educated indigenous people are less prone to addictions like alcoholism and smoking. There is a connection between educational attainment of a community and their health. The next one is physical environment. Physical environment such as housing, occupant safety, and hygiene also affect the quality of health. As a result of this, lack of housing and high levels of occupancy, overcrowding is common in this type of areas. Overcrowding therefore creates an environment in which there are more chances of disease to occur. According to 2006 census, Australian Bureau of Statistics at national level, there is an approximate difference of 30% between the Aboriginal and non-Indigenous housing occupancy. The next one is health service. Remote areas generally lack access to service such as transport. This can affect their visit to a health professionals. According to Australian Institute of Health and Welfare, Aboriginal people were 3 times more likely to have a transport difficulties as compared to non-Indigenous Australians. Moreover, they are also deprived of the basic amenities such as nutritional food, health environment, and clean water. In this slide, we are going to discuss how significant it is for nurses to be culturally competent in their practice. To provide effective and quality care to the Aboriginal community, nurses are required to have a knowledge and understanding of their language, culture, and beliefs. According to Nurses and Midwifery Board of Australia, nurses should respect all cultures and experiences. For example, acting in response to the role of family and community that affect the health of Aboriginal and Torres Strait Islander people and people of their culture. Nurses are required to form therapeutic and professional relationship with the patients, which includes building trust and forming culturally based environment for them. According to NMBA registered nurse standards for practice, nurses also required to respect the diversity, culture values, ethnicity, and beliefs of the people who are receiving care and treatment of their colleagues. In the local community services, Aboriginal tend to feel safer and comfortable. There are several government implemented specific Indigenous healthcare programs such as Closing the Gap programs and Tackling Indigenous Smoking. The nurses need to identify and to work in the collaboration with the community leaders to successfully implement them. To work in an Indigenous community, nurses must have good listening skills, must be open-hearted, and should be able to respect the values and cultural beliefs by avoiding racism. They need to have a good interaction and communication with the Aboriginal people. With the Aboriginal people, they must be able to differentiate between the verbal and non-verbal communications and able to understand the variation in linguistic and cultural aspects by avoiding the miscommunications. Nurses need to follow the culture protocol, which are very unique and sensitive to the culture of the community. With the greater knowledge and understanding of the diverse culture, customs and protocols of Aboriginal communities, effective care can be provided to the people.
Overall, this assignment has its central focus on Aboriginal people. This assignment clarifies their culture, values and beliefs and the way these aspects are interlinked with their health. Due to limited access to healthy food, transportation, education and other basic needs in rural areas, they are experiencing a lot of problems. So in this case, strategies such as health promotion can provide beneficial for them. This assignment meets the aims and objectives as it describes the link between Aboriginal people and their health, explains the social determinants of health related to cardiovascular disease in rural areas, and describes the implications and the protocols that nurses needs to adhere to in order to provide quality care to Aboriginal people. Now, I would like to summarize how our research and study will affect our future nursing practices, which will help us to improve overall health among Aboriginal and Torres Strait Islander community. As we have discussed earlier, we understand how significant it is for nurses to reflecting awareness of on and Aboriginal specific customs and culture values in their practice. As a nurse, we are required to adopt specific verbal and non-verbal communication and consultation with the local community members for providing effective health care. We need to adhere community specific protocols, promoting engagement and participation of family and local community members in the healthcare, as an advocate for anti-racism, and also avoiding non-judgmental approach. Overall, culturally competence will help nurses to provide a safe practices addressing the health issues in the specific community.